all the technical challenges of building an AI product exist. I think the thing that is always very prominent in front of mind for both like me and my team is the safety aspect of it, right? Like you're working with sensitive data, but even more than that, you're working with people that like really need help. And so you can't be in a position where like you are blocking access to the practice. Like, I mean, popularized thing is like move fast and break things, right? And I definitely believe in moving fast, but if you break things too much and you block access for a patient that really needs care, like you can't be doing that. It doesn't matter if you're starting out or not.
So welcome to Interlude, where we talk about the current transition period between the pre-AI and post-AI world. Today we have our first guest, Ryan Tsang, who is a good friend of ours. We've done a few hackathons together, which you might have seen on my other channel.
That's right.
And now he is a current member of South Park Commons with us. So I'm Jake, one of the co-hosts.
I'm Vatsal, one of the co-hosts. A little bit about Ryan. So Ryan is a current founder at South Park Commons, which is a community that we're all a part of. Previously, he worked at Azure OpenAI for 4 years, where he worked on an earlier version of the fine-tuning product. After that, Ryan switched to training models for open source AI safety benchmarks at MLCommons. And now you're building something. So yeah, let's get to it.
Yeah, maybe we can start off with you telling us about what you're building at South Park Commons.
Yeah, sure. So I'm excited to be here. I've never done one of these before, so this is a first. What me and my team are building here is really what is that AI native medical clinic that should exist in the future? How do we take all the work that shouldn't be on the plates of doctors and the time that they need to be seeing patients and giving high quality care? How do we return as much of that time back to them as possible? And really, I think what we're trying to solve is this supply problem. Honestly, it's a global problem, right? There's not enough high quality care to give care to the people that need it. And I think AI is a huge breakthrough. I do think we have a long ways to go before we figure out the right way and the right form to deliver that to patients. But that's really the mission that we're on, is how to increase the supply of high quality care. And really, I think from the angle of enabling physicians, we want to keep physicians at the center of everything.
And how did you kind of arrive on that idea?
Yeah, long story. I think it's a combination of both like personal experiences as well as like me and my co-founders, like a lot of sort of like jamming on ideas. And really, I think ultimately it just came down to spending time with clinic owners and physicians. Personally, like I've been tied to healthcare for I think a while. I grew up with a grandpa as like a second father, and he was sort of a victim of this like lack of supply of quality care. There's so much work that needs to be done within a health system. And so there was, a scan that should have been followed up with and should have been, someone should have advocated for reviewing that result. And as many things do, it just slipped through. And by the time we found the cancer again, it was in his brain. And so the train had left the station at that point. And when I lost him at 14, that was a very, very formative moment for me, in that I, at the time, wanted to be a doctor, I should say. But in reality, what that forced me to do is like spend as much time, like I started to spend as much time as I could in hospitals and clinics as a high schooler. And kind of set me off on that healthcare journey. I went to UCLA for, at first, pre-med and bioengineering. And I was doing that until like junior year. And I actually switched to computer science my junior year, mainly because I was just not so confident that like being a doctor and like going through all that schooling and like the research routes were like going to be the fastest way to kind of induce change and create step change in the medical world. And so I wanted to arm myself with a much faster paced skill set. And so that's why I switched to computer science. And so the intent was always to come back to it, right? Which I ended up doing many years later, like now. But yeah, so like personally, there was a lot of drive to go and do that always. And then when me and my co-founders got together, there was the shared sort of understanding of all three of us are like very closely connected to medicine via family members are like majors and stuff like that, and time spent in these clinics and settings. And so there was this consensus that so many things slip through, and that needs to be solved. And AI provides an opportunity to kind of help with that. And so that's when we set out to just spend as much time with clinic owners as possible. And being in those offices, spending, every week, like spending hours talking with like the administrators, it became increasingly clear, like, okay, there's a lot of work to be done here. It's an obvious problem, but there's going to be many ways to solve it, and we should start looking at that.
That's a very noble motivation.
Yeah.
Thanks for sharing. You mentioned you've been working very closely in these sorts of clinics. What sorts of clinics are these? Do you embed yourself in them?
Yeah. Yeah, good question. So it's been a variety of them, but I think mostly primary care to this point. Primary care to us is really interesting because it's the front door to medicine. And I think the better you are at preventing, issues from happening, the cheaper the cost of care gets downstream. I think you definitely need to be embedding yourself. I spent my professional career building software. And of course, I spent lots of hours in hospitals and clinics growing up, but there's really nothing that replaces when you're solving a problem, like being there. And luckily there's a combination of stuff now with, being able to take calls and be on Zoom and screen share and stuff like that. So we definitely leverage that when we can, but I definitely don't think there's any replacement for just being in the clinic. And so when we would go in clinic, and I'm doing things that I was trying to do 10 years ago, thinking I was going to med school, which is like sitting by the doctor's side and trying to see what they're doing. And now I think there's a lot more focus on okay, what are the other members of that office doing? So what is the staff doing? How do they spend their day? What kind of work do they do? So yeah, looking over the shoulder is incredibly important. And that's, for me as an outsider coming to learn and educate myself, there is no replacement for that. So absolutely.
Yeah. There's a lot of tasks that go on inside of a clinic. Where do you kind of approach, what problem are you tackling first?
Yeah. So, you can roughly divide the tasks into more clinical and then non-clinical. Definitely we are starting more on the non-clinical side. I think that is the lower hanging fruit, but even though it's low hanging fruit, it's incredibly important, and there's a ton of work to be done there. And so even within the non-clinical side of things, there's, care coordination that you have to do before the visit. So before the visit, during, and after. So before the visit is a lot of scheduling, making sure their insurance is verified and they'll be able to pay for it. Intake forms. Then during the visit, that tends to be a little more clinical. That's where I think scribes have really taken off, the note-taking side of things. Maybe something like the ordering and whatnot. Well, so after the visit is generally where you do a lot of the ordering, medication filling. If there are authorizations you need to get done to get those orders and get those orders through, then that's where a lot of paperwork comes in. There's also coordination of you don't just see your doctor and then you disappear for a year. Actually, most people do that, but a lot of times when there's issues, you need to get routed to another doctor, and sometimes that needs an authorization, and so that needs paperwork and that needs follow-up. So there's all this sorts of care coordination type of work that happens around the visit, which falls on the shoulders of a lot of staff typically. And where you have a shortage of staff is where you start to see some of those leaks show up, right? Someone that really needs to be seen is not being prioritized and getting followed up with. Someone who's rather sick is not getting followed up with after the visit. Hey, did you go see the specialist? Or, hey, did you actually adhere to the medication? How are things going, right? There's just so much work that needs to be done that if you don't have the staff to keep up with it, what are you going to do? The doctor's seeing tons of patients every single day. So it can go on, but there's all sorts of work that needs to be done outside of even the visit.
So do you build the software that underlies this work so that people at the clinic can work on top of it, or are you building the automations to be able to completely replace some of these workflows? You define many different types of workflows.
Yeah.
One before you visit the clinic, one during, and one after.
Yeah. So, the dream is really to build an operating system that encapsulates all of this work. And you have to start somewhere, right? And so the stuff that we've been live in clinics for has mostly been on just like simpler stuff like the phone side and the scheduling side at the moment. But for us, like we're always thinking about like how do we start to like piece in the end-to-end components, like what else happens, like the messages, the faxes that happen. And so we are definitely like building, I guess, what is popularized as like a system of action layer. We work on top of, at this moment, we work on top of like their system of record, which is called the EHR. And so we integrate deeply with that. We try to keep their workflows as familiar as possible. So the adoption is very easy. But yeah, absolutely. It's like automations on top of some of the existing workflows they have. And the idea is to start pulling some of the work that shouldn't be on their plates off of them.
I guess working in healthcare, then, what are some of the harder technical challenges you're facing? I think like, these days, a lot of people like they just like prompt their way to some agent, but like, what are you seeing in like production?
So there's like a number of challenges, obviously. I think all the technical challenges of building an AI product exist. I think the thing that is always very prominent in front of mind for both like me and my team is the safety aspect of it, right? Like you're working with sensitive data, but even more than that, you're working with people that like really need help. And so you can't be in a position where like you are blocking access to the practice. Like, popularized thing is like move fast and break things, right? And I definitely believe in moving fast, but if you break things too much and you block access for a patient that really needs care, like you can't be doing that. It doesn't matter if you're starting out or not. So
what does that mean? How would you block access?
like, for example, like if a patient's really trying to reach the office and they need to get in contact with someone and your system is like blocking their ability to reach the office and get their message across, then that absolutely can't happen, right? Someone calls about emergency or like an urgent test case scenario, like that really needs to go up to, the office and the physicians. So how that turns into like work for us is like we need to be exceptionally diligent about like the evals that we run, the way we monitor the systems. A lot of it is like things that don't scale at the moment. Like I and my team, like we'll look at a lot of like the calls, like everything, just to make sure we don't miss something right now. But eventually that won't scale. And so developing the systems that really catch these things is part of the technical challenge.
So this is for like a AI voice assistant tool for the clinics?
Yeah, even if you take that, right? But this extends into the other workflows as well, right? If you have messages and faxes with important information, like those really can't get lost. Like those are the things that, for case in point with like my personal story with my grandfather, like you need those things to show up constantly, like be reminded about, like this is urgent, like this is stuff that should show up. And so if you're part of the problem and you're losing stuff, like it's an issue. So being diligent about that, being responsible, making sure you're setting up these systems to make sure that you know when something's off or make it easier for you to know when something's off so that you can notify the office is really important. Like literally the other day, like when I go through and scan through a log and I saw like, hey, like, yeah, we sent a message, but like, I just really want to make sure that the office knows. Like I'll literally get on the phone and I'll call the doctor, I'll call the office and I'll be like, hey, like just checking, did you see this? And one, I think they really appreciate that. But then two, it's also a feedback loop of like, hey, like, okay, like how do we make this system even better? Like how do we make sure this surfaces properly? So that's definitely something that we do as well.
I'm kind of curious. You're like mentioning all these like systems of records, like faxes. How much of this is actually like a data plumbing problem versus an AI application problem?
I think so it's twofold, right? I think both of them are actually issues. As you well know, I know you have background in this, right? But healthcare is not the most interoperable. We are fortunate to like, for our clients, like we're fortunate to work with systems that do support this sort of interoperability pretty well. But that's not the case with all these systems, right? What I mean here is that when you work with these different clinics, like they might be working on different EHRs, and different EHRs mean that you need to build like Harmonize, we need to go and build integrations into those EHRs so that we can make sure the data flows properly. Each of those EHRs might have different data models. Even if you have two clinics using the same EHR, they might be using their data model a little differently. And so you have to figure out how to reconcile that. So it's not the easiest problem. I do think AI makes it easier to deal with some of these issues, but it's definitely something that requires a lot of thought. On the AI side, it's definitely, there are definitely challenges there in terms of, as we know, like the forward deployed engineering has gotten very popular, and there's a reason for that. It's because like each customer, each clinic might have like slightly different ways of how they do things. And AI prompting is like very, very sensitive, right? Like you have these system prompts, but the context is incredibly important, right? And the tribal knowledge that's locked up in each of the clinics is incredibly important. And so it's almost this game of how do you effectively extract that tribal knowledge out and encode that into your agent, right? And if you're not careful, it can be a lot of work, right? And so that's why you see forward deployed engineering, like going after really, really big customers, because the amount of effort, I think traditionally it's a lot. So for us, like what's top of mind is like, okay, how do we like think about a little bit of, scale down the road? Like how do we make it accessible for even like the smaller clinics to be able to onboard to where they don't have the ability to just always have a FDE on hand. So those are the two, answering a question of like interoperability, plumbing, and then the AI side of it, that they both exist, right? Those are both challenges.
How often do you see primary care clinics or, these sort of clinics that you go to miss things? Or like you mentioned that this is a common theme, and that you had to like manually call a clinic and be like, oh, here's this fax that came in that you missed. Yeah. So is there any sort of data that you've seen, or how often do you see this happening? Or is this something that's like widely known within healthcare?
I think all the above. Like I do think it's widely known. And part of that is like any physician or a clinic owner that we talk to just like immediately understands what that problem is. They're like, yeah, things slip through all the time. And I do think they're like true superheroes, and like they do their absolute best to keep up with everything, but it's just impossible. Like if you look at the amount of work that they have to keep up with and everyone they're responsible for. And then, like I think in the clinics, like with the clinics that we've worked with, like, we do see like, these messages come time to time that like, hey, like if we're not careful about it, like these could slip through. And then, my personal story is not unique, actually. Like there's so many people that have this story of something that was missed that should have been caught earlier, that should have been escalated earlier, that just wasn't because of, for one reason or another. But I think it's a very real problem. I think it's something we've seen, even with people we work with, but the personal side of things as well. And then talking with owners themselves is a very common problem that they have to contend with.
I'm kind of curious then, because as you said, you're not a doctor, and you're working within like a business that requires a lot of medical knowledge and a lot of knowledge about like the processes.
Yeah,
how do you go about trying to gain that like domain knowledge in this space? Because like I'm sure you can't have direct access to patient information, right?
Yeah, well, super fair. It's, I'd still consider myself, an outsider coming in. And I think there are advantages of that in terms of bringing new creative ways to solve problems. But fundamentally, what you said is right. Like this requires a lot of medical knowledge. It's usually not very foreigner friendly. So I think there's an approach that you have to take, which like you really have to be a student of the game, and you really have to be open to learning. And that means embedding yourself as often as possible. It means surrounding yourself with like mentors and advisors, which we have done, that really understand this problem before us and can sort of steer us clear of, pitfalls and obvious issues and errors. And also our second ear in terms of like, hey, like we have this maybe more clinically important issue, like we need help with it, right? But I think beyond that, it's like really dedicating yourself to the customer, right? Like our customers and our early design partners like really open up doors for us to be very integrated into both their clinic, their patient data as well. We sign BAs and we get HIPAA clearances with them, but it's very important for us to start to understand that context and really embed ourselves as much as possible. So like the countless hours that we spend week over week with the customers is like part of that education experience. So I don't think it's the right. I think there's a lot of this. I think especially recently, there's this idea that hey, like healthcare is $1 trillion market. Like there's such big business to be built here, and like you just go in and like you bring your tech knowledge and you just go after it, right? Like, I think there needs to be more of a respectful approach in some ways, and I think that is why like it's been so nice to work with some of these other clinics, or I think from their perspective, why it's been nice to work with us at Harmonize is that we approach it with that kind of respect. I think that's needed. Because I think all three of us, my co-founders and I, like we all understand the importance of like truly understanding like what the workflow is and like why it's there and what is it that we don't know and what can like the physicians and the staff like teach us about it. So yeah, definitely a challenge, but definitely something that I think we're like trying to be really diligent about.
So yeah, so let's talk about how you incorporate AI agents into these clinics as well. How much of the, like I know Jake previously asked a question related to this, but I'm wondering how much of the work that you do is related to the data pumping or the infrastructure side, and how much of the work that you do is in AI agents for actually making an impact at these clinics.
Yeah. It's definitely a combination of both, right? I think definitely table stakes is you do need these sort of like integrations into plumbing the data back and forth, right? Working with patient data, working with their calendars, doing it in a HIPAA compliant way, doing it in a secure way in general, right? But to be honest, like that's not really where the magic is. The magic is on the AI agent side. You are building agents for them. You are basically encoding their operating procedures, their domain knowledge, their tribal knowledge within that clinic. You're encoding that into the instruction set for the agents to operate on, right? Even if you take something like a receptionist, right? It's a matter of like, for these appointment types, like what are the questions that need to be asked? How do you clarify them? What's the protocol for, even allowing that type of appointment to be scheduled? What if like a patient calls in complaining about X, Y, or Z? Like how much of that do we want to triage to, this person in the office versus this other person versus let's just take a message and have someone else deal with it, right? So there's a lot of effort, I think, around that to encode that operating knowledge into the behavior of the agent. And then moreover, like, to get a working agent in the first place, like there is work to be done. Like I don't think we're quite at the point where you can just like snap your fingers and just like have this like working agent. I think we all want to get there. And I think within each of our verticals and domains, we have this dream that it should be that easy. But right now there's just like, a lot of work that goes into even just like the basics of like making sure the agent converses naturally between like you and the person that's calling in. Is the agent following instructions in the first place? Like, did you configure the architecture of the agents correctly? Do you have like really, really good evals and monitoring systems in place, right? To be able to capture errors when they happen, classify them. And I think there's also a lot of work as like over time, as like things change in the practice, like, and things drift, like, are you keeping up with that, right? Do you have a way to change manage? Do you even know that change management needs to happen? And so there's an incredible amount of work, I think, on the AI side that you need to get right to be able to deploy in production.
Can you walk us through an example of how one of your evals for your AI agents might look like?
Yeah. So, I mean, even on, like, I think this was like super critical, and I think this is probably table stakes for any voice agent as well. But what you're really trying to test for is like scenarios, right? You want to make sure that the core scenarios for a customer or just in general, right? Maybe it's like a specific tool that you've added for the agent, like works. And so what you're really trying to do is define a set of scenarios that effectively cover all these different behavior avenues for the agent. And how we've done it is like we've set up this sort of system, and we built this in-house, and there's plenty of solutions, I think, out there that exist that as we scale, we may need to look into. But really what it is like we define a scenario, we have our agent that we want to test, and we have a sort of like user simulator, which is just someone speaking back and is trying to role play, the caller. Or in our case, it's like role play the patient, role play the hospital that's calling in, right? And so they kind of have this script of like, hey, I'm this person, I need to behave this way. Here's the core thing that I'm trying to do. And you basically, put those two agents together and you kind of simulate this conversation. And what you do after that is you look at the transcript, you look at the logs, you look at the tool calls, and you essentially grade it on that. You have this like rubric. Some of the rubric can be LLM as a judge. Some of it can be just like deterministic. You check the tool calls, whether they're allowed or forbidden, right? And to get to sort of completion is like you need, and honestly, this is the hard part, not necessarily the technical part, but you need this understanding of what scenarios I need to cover, which ones I need to run and really make sure I pass. And as you start to get more and more real data, production data, like that needs to kind of this feedback loop, right? Like you need to get that into your eval set. You need to be like prepared to kind of change things out as things change in the practice. And so I think that flywheel is really important to get right. And like it's like sort of the biggest challenge.
Okay. I'm kind of curious because when I first started building my eval set, I literally, for browser agents, I was literally watching the agent click through the browser, and then like if it messed up, I would add that to my eval set.
Yeah.
How was it like building your kind of like first initial like golden set? Is it like a manual process or did you?
Yeah. So I think like in the beginning, like when you don't know anything, you like try to think of the scenarios that make sense based on the rule. It's a lot of conversations with the customers, I think, in the beginning, especially when you're new to a space, right? I think over time they sort of stabilize and you kind of can assume like which are the core scenarios that exist from clinic to clinic that you definitely need to pass. But it's a lot of staring at manual traces. It's a lot of just like even just getting on the call yourself and like testing it out. And then as you start to get more production data, like you do need to stare at it a lot. You do need to like think about, hey, do I have coverage for this? Is this a new scenario? That gets worked in. And then eventually over time, like you develop more and more automated systems to kind of like watch for stuff and flag it. Or if a customer flags something, that's what sort of prompts you to go and take a look at your set and evolve it over time.
Can you use production data to build your evaluation sets in this use case?
I think so. I mean, like obviously you need to be careful about like patient data. So it's not so easy as just like you just like grab and pull it in. But like, yes, like almost, I think your most important test sets should be informed by what's out there in the real world. So I can't remember where I got this advice before. I mean, there's a lot of people that talk about evals, but when you first start, I think if the point is like, how do you get to production and like get a system that starts working in production more and more, like it's kind of silly, but like you do need to get into production. And so like, you don't want to figure out this like 100 case test set that clears you to go live. Like I can almost guarantee you like 80 of those probably aren't relevant. What you want to figure out is like, okay, like what can we really not screw up? Right? Like what really needs to be like true for us to be able to turn this thing on? And like, I know there's going to be mistakes. Like my customer knows there's going to be mistakes and the expectation is like set there. But how can we start to like touch reality? And once you touch reality, that's when your data flywheel starts. You realize, you start to sort of align on like, hey, what actually matters? And then your test cases get better, which means you can turn it on for longer and get more data. And then like the flywheel starts from there. But I wouldn't like, you can like do a bunch of synthetic tests right in the beginning, but like until you touch reality, you're not going to know.
That's very interesting. We had Charles O'Neill come to South Park Commons for a talk, who's like co-head of monitoring and based, and he called touch reality. They had a term for it called touching grass, which essentially means that you need to be very close to your production data to be able to build evaluations.
Yeah, I think that's totally true. And I think you need to optimize everything to accelerate towards that in a safe manner, especially for us. Like we're in a place that you can't just be sloppy. But I think you need to accelerate as much as humanly plus AI possible to get production data. And once you do that, you can start to build out the flywheel.
Do you anonymize the data at all?
Yeah, I mean, we have to scrub it so that we can like, we scrub it as much as we can. Right. And in general, if we're going to store any of it to like turn it into like an eval set, then yeah, we need to anonymize it, kind of shuffle stuff around. We don't really keep the raw like patient data anywhere, just because like in our contracts with these clinics, sometimes like they don't want that, right? And in general, is like you don't want to be hanging on to that stuff for too long. What you do want sort of though is the like insights on like how does that practice run, and like what are the instructions that I need to update for that? What are the test cases that need to exist in the future for that?
Do you scrub the like calls as well, or is that just not recorded?
A lot of stuff is transcript based, right? So then you scrub the transcript, and you try not to. At this point, like I think there will probably be use for the audio at some point, but we try not to hang on to like the raw audio for too long. So we turn them into transcripts, we scrub them, and that's generally how we've been operating.
How do you get these clinics to trust you, or
Yeah.
why do they say, oh, like how did you get the first monitor, for example, even trust you that you'd come on board and help them out?
Yeah, I mean it is there's this like phrase which I mean I think is overused, but like honestly it's true. Like everyone talks about healthcare moving at the speed of trust, and trust is huge. Like trust is everything. And how we got our first customers, like we were lucky in some sense that a couple design partners like really opened their doors to us, and they were very excited about AI. And I think based on our backgrounds and some of my co-founders' relationships with them, right? We sort of got that like first person to say like, hey, like I'm willing to try this out. And at that point, it's like all about how you operate with that customer. So being very transparent with them as much as possible. It's this educational process as well. I think, especially when you're working with your first customers, right? They might be excited about AI, but they might not know exactly how it works. And for us, like we are technical, but like how do you explain it to them in a way that they understand? I think is really important. Something that someone doesn't understand is like, how do you trust that? So being able to communicate that effectively is really key. I think, yeah, being as transparent, like following up a lot, like this communication loop with them is very important. And then I think for us, like a big strategy is like, why don't we start with things that are like easier to deliver on and treat that as part of the education process, right? So for us, it was like, hey, we could come in and we could, build this entire OS for you, right? And you move everything onto us right away and just trust us, it's gonna work. Or I think what makes sense for a lot of these people that are getting used to AI is like, you just take something very like a narrow use case for us, like after hours calls, right? Something that doesn't even really require connecting to their EHR. It's a very simple system where you just, hey, you pick up the call, you do a very basic, like elementary kind of triage on it to make sure like, hey, if there's any risk of this being unsafe, like we escalate it, right? And then if it's not, you capture those routine messages for the office in the morning, right?
Escalate to who?
Escalate to someone who's on call. Right, whether that be the physician or if they have an on-call team. If you do like that workflow is like a much simplified version of maybe a broader platform, but you can start with that very quickly, and you can start to build trust that like, hey, like, oh, AI like really works, and like I'm starting to understand like how AI would work in my clinic. And so when we were able to deliver on that workflow, that has opened the doors to us. Case in point, like with one of our customers, right? After the after-hour system was working very well, they're like, okay, what else can I do with this, right? Like, where else can this go? I love this. And so I think it's a smart idea, I think, to figure out what that first workflow is, especially if your customer requires some education as well.
So you mentioned that, you have to build your evals for your AI voice agents.
Mm-hmm.
You have to build out a lot of the harness around it. You have to do a lot of the data plumbing.
Yeah.
There's a lot of technical challenges there. But your past experience has been in training models at Azure OpenAI, at MLCommons. Is this a switch for you, or do you get to use the skills that you learned while building your current healthcare company?
Yeah, so I think it's a combination. I definitely think there's always like a switch. I think when you're working at like bigger companies, like the amount of I would say the biggest meta switch is like you go from these massive companies with a lot of resources, and then a lot of spread out responsibility. And it doesn't I feel like I had a lot of responsibility at those companies, but there is nothing that replaces when you are like, you and your team are like solely responsible for like the entirety of the product, right? That just requires like a switch in a mindset. Now, as it pertains to like my knowledge about AI systems and how they work, and especially how it's evolved from, let's say, when I joined Microsoft in 2020, and what ML looked like there to, now 2026 now, and like how different it is. I absolutely think like a lot of that translates. And so this concept of like, experimentation and managing these cases and understanding when's the right time to apply what piece of like ML. Like now we have all these different layers of like prompt engineering, harness engineering now, fine tuning, and so on and so forth, right? Like understanding when is the right place to apply those, and also understanding, I think, the importance of evals, which like I spent a lot of time thinking about, I think back in even as early as 2023, and just like I've continued to carry that importance, throughout. Like now it's very natural for me when I think about how to start solving a problem. It's like, okay, these are the steps I need to do to kind of check before I can get to a place where I feel comfortable going to production with it. And this is also like how I know I'm going to hill climb with it too, right? Like it's easy to get some demo out, but like I also, me and my team, like we understand like, okay, how do we start to get better? Like what are the things we need to set up in place to get better?
So do you fine tune and post train models?
We like at Harmonize?
Yes.
So we don't do that right now, but I think part of that is because like, I think you almost have to like earn your way to that. So right now for us, like we really need to get to like a level of like product market fit. And like we'll do as much as we possibly can, kind of like squeeze as much juice out of like the prompt engineering, the harness engineering as possible. And then, I mean, I think down the line, like our master plan is like really to, with this operating system to start handling end-to-end care delivery, and that is going to create this, new data set worth of knowledge that I think would be largely untapped, and it will be out of distribution type of data. And I think at that point in time is when you'd start to look at like, okay, like how do we start to encode this knowledge into models? And then I think that's where you start to think about like, okay, we were sitting on this like unique flywheel of data. How do we sort of take that and turn it into, an asset for the company, and an asset, I think, really for everyone moving forward, right? And so at that point, you'd want to train.
What's your biggest challenge or blocker at Harmonize right now?
The biggest challenge, I think, for us is we really think about like what's the right way to sequence the product, right? Like we have this grand vision of like what can the OS look like, and there's a number of ways to get to that end goal, and what's the right way to do it. So what's like the next set of features that we want to like bring into the product that will really deepen the benefits for the practices that we work with. And then because I think if you build like a truly wonderful experience, it makes it that much easier to kind of, you have customers that can advocate for you, right? That love your product, and that'll help you eventually in the distribution game moving forward. I think for healthcare, I think distribution is a massive challenge as well. Like how do you get out to people? And so that's very top of mind for us in terms of, hey, who do we work with? Like who do we bring on to both like our team, the advisory team, and position ourselves in a way that when we're ready to like really open up the doors, like how do we maximize that as much as possible? I can keep going. There's tons of problems, as you guys well know, is in building a company, but those are some of the ones I think that sit top of mind for us right now.
I kind of want to pivot a little bit and kind of understand why you wanted to even pursue like building your own company, because you worked at Microsoft. That's a huge, like, I think that's the biggest company in the world.
Yeah.
How do you go from that to like starting your own? And maybe, we've seen some of your like posts online. Maybe you can like talk about like TempShot a little bit. And
you really dug for this one, didn't you? And I wonder if you guys, we were all at Microsoft at some point together, right? Different teams, but Microsoft for me never felt like, even when I walked in 2020, like my mindset was like, oh, like I'll be here for like a year and then I'll leave and I'll start my own thing. I feel like the bug of wanting to build and just create things has like always been something that I wanted to do since high school, really. High school is when I discovered programming. Me and a good friend of mine, shout out Trevor, he and I, he kind of introduced me to programming, and we went to like a hackathon at UCLA as early as like our junior year. And Trevor, he actually like advocated for our school to add in computer science's curriculum, even though we really just didn't have the support from the staff, someone that knew how to like program. But ever since I learned how, like, it's kind of like learning how to like craft something, and once you get that feeling that you can do that, it's just like addictive. And so my first TempShot, my first app was something I shipped at the end of high school. And it was this, it was really...
Why don't you pitch it to us as if we're a VC and you're pitching TempShot?
Oh yeah, the business model is incredible for this one. But I really what it was is like, you know, back in high school, we used to just like take pictures of whiteboards and take pictures of, you know, homework and share them with each other. And back then, like, what was it, 2016? Like maybe we had like 8 gigs, 16 gigs, 32 gigs of space in our devices. And so I was looking at my camera roll and it was just like full of homework pictures and none of like my friends' photos. And so as a way to sort of save space on your phone for photos that you know you're just not going to keep, like why not have a temporary photos app for that? And so that was TempShot. You could, you know, take a photo, you could set a lifetime on it, and then after that lifetime, it just auto delete. So your homework that, you know, happened a month ago, like you probably don't need it anymore. So it just clears it out. And so then your camera roll is just purely like memories and stuff like that. So I went and I did a whole, before launch videos were cool, like I literally went and created a whole launch video for that, grabbed my friends and...
We saw it. It said a basketball.
Oh, no. we don't need to review that, but it is technically unlisted, I think, on YouTube somewhere. I don't know how you found it, but good for you.
But that's a very far way. You come from TempShot in high school to building Harmonize today.
Yeah. And I guess like the additional points to it were like, you know, once you do it once, you're like, oh, like I want to do it again. And so like in college, I also tried to build more things at that point. So me and my friends in college at UCLA, like we tried to build this like contact sharing. You know, like when you bump phones now, you can share content. It was sort of like that, but it was, I used QR codes because back at that time, iPhones didn't have NFC yet. So you could like scan a QR code and you could exchange your like Snapchat, Instagram,
What's an NFC?
NFC is like the device or like the piece of hardware that when you touch phones together, you can transfer information. Yeah. So that's the reason why Bump works now, but only Androids had that back in the day. I say back in the day as in like 2018. But that's why I built in like college. And then, you know, even when I was in Seattle afterwards, like post-COVID, me and my friend, it's a classic tar pit idea, but like me and my friend were like, oh, we need to like encourage like our friends to get out there and do more like bucket list ideas. And so we built an app that we brought like a few hundred people on from Seattle to kind of like, it's like a social media for bucket list items. And you could like post your bucket list item. Your friends could like upvote it if they wanted to join. And then that would turn into, we'd gamify it. Like each one had a lifetime that was like expiring and ticking down. And the ones that got popular like turned into actual events. So it was really fun to build for a period of time. And yeah, it was just like, I think constantly, to answer your questions, like constantly just like trying to think of like, what can we build? Like, what are fun things to put together? Who are like cool people to work with? And I've just like always had that itch. And so even though I was working at Microsoft, like I knew that eventually this would be in the cards one day. But Microsoft ended up being very interesting just because of where AI started to take off, I think, in that time. And so it was extremely relevant and helpful to like really educate and like become an expert on what it takes to build not only the AI systems, but the infrastructure behind it and understand some of that. So always been thinking about it. I mean, like, you guys are building stuff now. Like, did you guys have like similar like points in high school or college where you like already knew like, okay, this is going to happen. It's just a matter of when?
Yeah, I think growing up, my parents, they owned a restaurant. And so I would often be working in the restaurant. But because I was, better at English than them, I would often do a lot of like the back office tasks for them. So helping them order more inventory for the restaurant or do miscellaneous like financial tasks. And truthfully, I didn't really have that itch growing up because I worked in my parents' restaurant. They to this day, they still work 7 days a week, like 12 hours plus every single day with 2 days off every year. And so they still grind it out there.
It's crazy.
In high school, I did with a few friends try to create like a clothing company. So we would go door to door in our dorm trying to like sell our t-shirts to other students. And we did sell like a few $1,000s worth of shirts back then. And that was a lot of fun. In college, again, I didn't have that itch, so I joined Microsoft. It was partly due to COVID, kind of like shutting down recruiting, and Microsoft was more of like a return offer for me. But I think as time went on, I started to just get bored with like the scope of my work and being like a cog in the machine in a sense. And I over time just worked at smaller and smaller companies where my next gig was at an 80 to 100-person startup. And then I quit to try to do my own thing for a second. And that was a lot of fun, but ultimately I needed money. So I started working at a startup as their first hire, which I found a lot of fun, but didn't quite find it the same as like working on my own. Granted, I still really enjoyed working there. It's just my friends started quitting their jobs, Vatsal being one of them. And at that point, we just decided like, this is what we want to be doing in our life. Like I genuinely love doing what I do and find that, I almost feel like I'm retired in a sense because I get to just work on what I want to be working on and not necessarily be bound to someone else's like vision or product,
Yeah. And there is just like this ultimate freedom. But you said like you originally got like the business sense of it from your parents' restaurant. By the way, the restaurant business is so unforgiving.
No, it's brutal. So many.
You're saying they still work on it 7 days a week?
Yeah, still 7 days a week.
Where is it? Can we visit?
It's in Alaska.
Okay, so hard to get to.
Maybe I don't dox myself quite yet, but if someone wants to look at it.
Yeah, go find Jake in Alaska somewhere. Spend your life doing that. Yeah. What about you?
Similar to Jake, my parents are also entrepreneurial. So when I grew up, I would see my dad. He did textiles manufacturing. So he's done textile manufacturing for over 20 years. So I actually grew up, like I used to live in New Delhi, but every year I would spend like 4 months in Harare, Zimbabwe. So I kind of like split my time because my parents had a manufacturing facility there. They had one in India. And it would be all sorts of miscellaneous things. And as I would grow up, I would visit my dad's factories. I would hear him talk on the phone to his employees, to customers. It was just very, like as a kid, I would just be observing and listening a lot. And I think that's when like my entrepreneurial ambitions were fairly set. And it also made me go into economics. So when I came to college, I was really obsessed with economics. And in high school, I had this thing. I was really into like equality and social justice in a way. So I had this like weird mix of things that I really cared about. And economics had this, has the business and entrepreneurial sense as well. And at the same time, economics and public policy also has this equity sense to it. So those two things really drew me to the field. And my friends, I was in my freshman year dorm with, Jake, Nick, my current co-founders, Ankur. And at my dorm, these guys convinced me that, computer science is very cool and interesting as well. So that's how I got into CS. And I realized that that is a way to actually implement change in the world.
Yeah.
So throughout college, it was just CS and economics. And I would love to like lead things. Like I led this club called the Berkeley Economic Review. So I was really into the entrepreneurial side. Like we would host a bunch of events. We would have to get people to come to our events. We would have to like do recruitment for the club. So it was like sort of the similar issues you face while you're building a startup, but in mini and much, much more simpler because, it was inside a university. So this was always something I wanted to do. The next 3-4 years, I worked at Microsoft and at Netflix, big tech. And I realized that I wasn't able to utilize all my skill sets as well. I was learning, but I wasn't able to utilize all of my skill sets, and I wanted to like be the best self that I can be. Jake was, I think, out of our group, one of the first ones to be like, all right, I need to do a startup, which is why, he joined Cloud Cruise as the first engineer.
You were the first to jump into all that stuff?
Yeah.
Nice.
And then just seeing his journey and working, I wanted to like work at Netflix a year and see how it is. I realized that, I need to do a startup, and I also decided to quit. And then, enough dominoes fell that we had the whole crew together.
Yeah.
Yeah, I think a fun origin story that we don't really talk about too much was in 2024 when YC released their first fall batch. I dragged these guys into applying. And again, Vatzel hadn't even started his job yet. So in a different dimension.
I was in Zambia then. Because my parents are now working in Zambia. For context, I was in Zambia and I was negotiating my offer with Netflix. And then Ankur and Jake calls me, and what do you guys tell me?
We're like, hey, this is the first batch, we think this is a great opportunity with where AI is. Why don't we try give it a shot with us four? We have nothing to lose. Like, we can just send out an application, right?
Yeah.
So I spent all night just like building an application with them because the deadline is in the morning. Like, they call me at 11 p.m. my time in Africa, and the deadline's around 7 a.m.
Yeah.
So we start writing the application up till 4 a.m. and we just crank it out.
Yeah. So you were international for that whole process, basically?
It was just a single day.
Oh.
They had an idea and they were like, okay, let's do it. And I was like, hey, I'm negotiating my offer for my next job right now.
Yeah.
I don't know, are we doing it? But we've had like a group chat where we discuss ideas, startup ideas for the longest time. I can't even remember how many years.
Yeah.
So I guess it was natural.
Yeah. But to be fair, we kept working on it for a little bit because, supposedly Gary Tan had like messaged us asking like, hey, do you guys have customers or like design partners or like any traction? We literally cranked the application out like the day before. So no, but we were like trying to like, all right, build prototypes, like trying to talk to people, like find like early design partners in like a 2-week span, was it?
Yeah.
And that idea was like AI generated survey responses. I think with more of like a vision towards like, something like artificial societies, I think, where like you're trying to run like experiments and you get these AI personas to like answer and give feedback on like product decisions and whatnot.
Yeah.
But ultimately, I think, again, there was just too big of a barrier. It's like, he was literally just about to start a job, and Nick was like, he was bogged down in both full-time job and his like master's at the time. Yeah. And I think Uncle was also about to start a new job. And so at the time, I think it was just timing wasn't right for the four of us.
Yeah. Do you ever feel, there's this element of like, I remember when like I decided to leave Microsoft, like I would argue like almost all the advice I got was like, maybe don't leave Microsoft, because like I don't think the timing was right per se. And I'm curious, like when you guys all eventually made the leap, like when you all lined it up, how that came together. But I really feel like when I left Microsoft, I had like the inkling of an idea of what I wanted to do. I didn't have a co-founder set up at the time. And with all that being said, when I was like telling my friends or family about what I was trying to do, everyone kind of like looked at me a little crazy of like, why don't you like figure some of that out first before going? And I sort of convinced myself like, oh, like the timing's never going to be perfect. Like I just got to like dive in and figure it out. And honestly, looking back, like I don't even know if I would like, if I was to give myself advice at that point in time, like what I would do, because I spent a long time like searching for what it is that I actually wanted to do, much longer than I had expected. I remember like a couple months after leaving, I was like, oh my gosh, I really thought this was going to be faster, but I didn't think it was going to take like at this point, it's been like 2 years, or like when I really started to pick up on a true idea, it was maybe like a year plus out from when I quit. And so, I don't know if you guys relate to any of that in terms of like quitting before you really have this like idea and like customers lined up and all that stuff. Like it's a lot of pressure, but like, how do you approach it? Because that's probably a big challenge, right?
Yeah, I think the reality has been like quite different from our expectation for sure. I think it depends on your personal situation too, because when I was like working at a startup, I was working basically like 996.
Yeah.
And so if I had to pursue anything, it would just be on like the Sunday that I had off.
Yeah.
And I was already like pretty exhausted from the week, honestly. I think looking back though, I would, with the knowledge that I have, like, of course, I've learned a ton in the past like few months that we've been working on this. And in an ideal world, like there are things you can do while you're at your job. Like you can, go to events, like try to network with people at prominent companies so that when you do quit, like you have an easier into like trying to interview potential customers.
Yeah.
I think one of the limiting factors right now is that like we're kind of, when you're so early, you're really depending on your like warm intros and your network.
Yeah.
And so one thing you can do while you have a job is like build that up, because people are more willing to talk to you if you're not like a founder. Because these days I feel like when you see like co-founder connecting with you, you're thinking, oh, this person's about to sell to me.
Yeah.
Versus like head of AI at some company or like an engineer at some company. It's like, oh, this can be a genuine connection. Yeah. I think that like kind of like you, like, yeah, we did have this expectation that like, oh, 1 month in we're gonna have our first customer, and then we'll like really like just shoot off. But the reality is that it does take some time to kind of like find your footing and realize like finding your first few customers is really, really hard. And even like figuring out what you want to work on is really hard.
Yeah.
Because you go through this like vicious iteration cycle where you talk to people, you realize your initial idea is not good or it doesn't actually solve a problem. Then you have to come up with a new one and you keep talking to people, but then it's really hard to find people to talk to because no one wants to talk to you outside of like your warm network. And you go to events and it's kind of like a random like, oh, maybe you'll bump into someone that's actually relevant to your ICP. There's just so many like little problems that you have to like fix and like play whack-a-mole with. And eventually like you'll reach a point where like, okay, I kind of know what I'm doing. You've kind of like A/B tested different strategies and layered on like that might be like messaging in your outreach, or not even doing cold outreach because you've tried a bunch of different strategies there. And it's definitely been like for us just like this rapid experimentation and trying to figure out what works for us.
Yeah.
The experience I think lent us a lot of maturity. Like we, like you, quit our jobs without an idea in December.
Yeah.
But we had a team. So that's what really gave me a lot of comfort. Like we had a team and I had friends that I really trusted going into this. But the expectations and reality were definitely very different. From the outside, it seems like, oh, something takes off, pops off, and then it's just roses. But
no one sees the
no one sees the really like the grind.
Yeah.
I mean, it's shitty and it's also really fun. And I think what we realize is that how you're able to get this blast off moment is by building advantages that compound. So
compounding.
Over the last like 4 or 5 months, 6 months, we've been focusing on building things that compound, because that's why from the outside it seems like startups just take off in one go. But really what's been happening is these founders have been compounding knowledge and advantages over the past years.
Yeah.
If not like months, years, decades even.
Yeah.
And that's what really takes the startup to pop off.
Compounding is like such a huge thing, which I always knew it was important, but I feel like I never really valued what it took to actually get the compounding advantage, right? And so for me, like I was not doing this when I first started, right? I was doing exactly what you're talking about, right? Which is it's like a job in itself, but like you make a list of, your prospective customers or people you want to talk to, you find them on LinkedIn or you use Sales Navigator, and then you draft a bunch of messages and then cold outreach, and you're just sending hundreds and hundreds of these for like a 5% response rate. And then you like book calls with the ones that, respond to you, and then you talk to them, and it's like a customer exploration. You're trying to figure it out. And that in itself is like a whole job of like exploring and trying to validate and find your idea. But to your point about compounding, like the issue I think I had in the beginning was like I couldn't stick to a particular idea. And so I would jump around from one idea to another, sometimes in different verticals. And like every time I was pivoting, like I wasn't able to compound like the network I was building. I wasn't able to compound the learnings I was doing, at least not effectively, right? And for me, when I finally realized like, okay, I need to like drop my anchor in somewhere where like I'm really actually passionate and like really want to build in and I want to spend time in, even if it's not the exact idea, like it's an area that I want to build my like, build up some experience in. So once I realized that was healthcare, maybe this was about at this point a year and a half ago, and I really committed to like building for healthcare and learning and building up that experience in the network, then I could actually see the effects of compounding. And like, it takes months. I don't know how you guys feel, right? But like, it was like pretty dead for like the first 3 to 6 months. Like you still are sort of in that grindy phase. And then like someone who you met 6 months ago reaches out about something that's like suddenly relevant to you. And like, if you were on a different idea, you'd be like, oh, like I'm not doing that anymore, right? But then that leads to like another connection. And like I've had a lot of people, like really generous people connect me to people that have helped me eventually in the future, right? And so even on that piece of it, like if you stick around in one area for long enough and your learning compounds, your network compounds, and like those lead to, it looks like luck from the outside, but it's part of it is like you stuck around long enough and you're persistent enough. And I think with this day and age, with AI allowing you to move so quickly and try things out, like some people miss out on it because they're like, oh, maybe this should have been easier or faster. I should go find something else or go after the next shiny thing. So I don't know. I definitely agree that compounding is huge and you need to stick around long enough to get that advantage. So,
Well, thank you so much, Ryan, for coming to Interlude. We really enjoyed chatting with you.
Yeah, come play some Catan later.
Yes.
Let's play some more.
Yeah, I would like to get my revenge.
Yeah, okay, great. You can try.
Yeah. Well, I guess that pretty much wraps up this episode. We hope you enjoyed it. And if you have any questions, like feel free to leave them in the comments. But till next time.
Yeah, thanks for having me.
Yep.